everyone, my name is Mimunat. You can call me Nasmuna. Welcome back to my channel. I'm glad you are here. Guys, this video is about UTI in elderly population. Before we dive in, do me a huge favor. If you find this information helpful, hit that like button, comment, share this video with your friends and family, and of course, subscribe so you don't miss any of my future videos. Well, what is UTI? Well, UTI is defined as an infection involving any part of urinary system, such as urethra, bladder, ureters, or kidney. This is common in elderly due to multiple risk factors and physiological changes. What are the risks in elderly population that actually make them prone to UTI? Well, the first one is age. The risk of UTI increases with age. Gender. Women are more likely to develop UTIs than men. Urinary retention or incontinency is another risk factor for elderly ones. Poor perineal hygiene. Let me put it in a simple term, or private part care, like, when you poo and pee, cleaning down there is the perineal hygiene. Dehydration. Another risk factor is the use of urinary catheter, indwelling urinary catheter or Foley. Another risk factor is immobility and functional dependency. Guys, if your elderly one is unable to go to the bathroom by herself, definitely it's gonna be a risk factor to develop or have UTI. Or if they depend on someone or this, personally, if they depend on someone to help them with their ADLs. Cognitive impairment, such as dementia, is another risk factor for elderly one to be prone to UTI. Chronic conditions such as diabetes, heart disease, kidney, these chronic conditions actually can increase their risk of having UTIs. The symptoms of UTI in elderly. Guys, if you are a caregiver, especially if your parent, grandparent, and client live at home, please pay attention to these symptoms. The symptoms to pay attention to, I'm going to classify them into two. One is typical symptoms, and the second section is atypical symptoms. The typical symptoms means may or may not be present, meaning that it's not a must they're gonna be present, but the possibility is there. The first one is frequent urination, urgency, dysuria. Basically, frequent urination means they go into the bathroom more than usual. Urgency, the urge, like I have to go more than their norms. As a caregivers, we know what's our elderly ones, our clients, we know what is their norm, like how many times they go to the bathroom. And the dysuria means like the discomfort when they pee. So if they are basically alert and oriented, they're gonna communicate that with you. So please pay attention to that and see if that persists, then you can arrange for medical attention for them. Another typical symptoms is pain or burning during urination. So they would basically let you know it hurt or pain down there when I pee. So that is a signal for you to know possibly your elderly one is having UTI. Another symptoms is a cloudy or foul smelling urine. We know how urine smells, so when they perceive or you perceive as a caregiver like something is off when they pee, then this is something for you to, to note so that you can follow up if other symptoms of UTI persist. Fever and chills. Not all patients will exhibit these symptoms, but fever is a sign of infection, so definitely it might or it might not present if they're having a UTI. For the atypical symptoms, meaning are key indicators in elderly population when they're having UTI. The first one is confusion or delirium. We often mistaken this for a flare-up of dementia, or sometimes if the patient is not if the patient is not a dementia patient, the family member possibly assume, oh, my parent is having dementia now. No. Well, if a patient is experiencing this, they will be confused in a way like they might not possibly remember where is the bathroom, maybe possibly they're gonna be confused. And for the delirium, I have seen a patient when her daughter was saying, oh, my dad is having dementia now, and for sure the patient was diagnosed for UTI. So when you know your mom, your dad, your grandparents, your client, when they are going out of norm or they're out of norm means their mental status, what they talk on daily basis. Once they are off and it's persisting, this might be signs of UTI. So please arrange for them to be seen by the medical doctor or a nurse practitioner, whichever one is available for them. And for confusion and delirium, let me add more to it. There is another patient that it was seeing things. It was seeing things like people were climbing the wall. It was seeing strange things. If your parent is not a dementia patient and they are seeing things that are off, please arrange for them to be seen by the medical doctor so they can test them to rule out UTI. Another key indicator of UTI in elderly population is falls or sudden incontinence. Yeah, elderly people falls. We, even young adults, we do as well. But when they fall more than usual, so this is something you need to take note of. Sudden incontinence means your parent or your care or your loved one or your client is able to go to bathroom herself, or she's gonna tell you, I gotta pee or I gotta poo, and all of the sudden she's peeing on herself. Please take note. This is what's it called? This is a sign or symptoms of UTI. Fatigue and weaknesses. This is another key indicators of UTI in elderly population. Agitation or behavioral changes is another key indicator of UTI in elderly population. Even dementia patients exhibit this sign. Nausea and vomiting is another key indicator of UTI in elderly population or elderly individuals. Well, as a geriatric nurse, we are trained, the nurses, the CNAs or the caregivers, we are all trained to be able to identify these symptoms. So once the CNA observe this, possibly combination one or two, whichever one the patient are experiencing in our facilities, they usually report to the nurse, and the nurse will definitely, she's gonna assess for me. Basically, I'm going to assess the patient, take the vital sign just to make sure fever is not present. So once I'm done with my assessment, I'm going to report to the doctor. Okay, doctor, this is what is going on. And most of the time, we request for UA order so we can roll out UTI or get the treatment started. Well, the diagnosis, once the doctor is done with the assessment, because if the doctor for elderly one not in a skilled facility or assisted living or all these facility available for the elderly one, if you are home with your parent, your elderly one or your grandparent, once you observe or noted or they report to you, okay, I've been experiencing all these symptoms, please kindly book appointment with their healthcare provider. Let them be seen so they can be assessed, and possibly the doctor is going to order for UA so they can rule out they can rule out UTI. So once the assessment is done, there's gonna be order for UA, C and S, which is done by taking urine sample. The another order doctor is gonna give is CBC, which is complete blood count. So basically for this, the doctor is gonna see if there is an increase in WBC, the white blood cell. So once the result is out, if there is increase in our WBC, yeah. If there is increase in WBC, which is white blood count, that means there is the patient is having a UTI, and it's a common sign of UTI. Back to the UA and the C and S. C and S means culture and sensitivity. Guys, once the result is out, if there is positive, if there is a nitrate positive in the result, this is a strong indicator of UTI. That's a strong indicator of UTI. That means there is a bacteria in the urinary tract. For the culture and sensitivity, basically this is to tell us the type of bacteria we are working with and the type of antibiotics the doctor is going to prescribe to treat the infection. Ultrasound is usually ordered if patient is having more UTI and if there is a complication infection for the patient or the elderly one. The treatment, let's talk about the treatment. After we have the result, then there's gonna be, usually the doctor use antibiotics. Let me say antibiotic is a major, might not be the only, but let me say it's a major treatment for UTI. And mainly it will be prescribed for longer duration than in younger adults. And in some cases, the doctor will order additional cranberry juice or urinary antiseptic just to combine with the antibiotics. So, the preventive measure for UTI in elderly population. Guys, kindly forward this video to your loved ones, your elderly ones, your private caregivers. Screenshot or print. Paste it somewhere everyone taking care of your elderly one can see it. And if your elderly ones they are alert and oriented, paste it somewhere they can see it around the house so they can see what they can do to help themselves. So, and I'm gonna say this, we can, talk to them. I understand, especially in America, our elderly ones believe that, oh, I've been taking care of you before you were born, so I can take care of myself. No, it's time for us to be part of their care. It's time for us to be involved, so we all can be on the same page. And there is a proverb that says, prevention is better than cure. So the first preventive care or measure that I would say is for them to drink plenty of fluids. There are so many smart devices nowadays, and I understand we're all busy, our careers, business, family. So there's so many devices, wherever you are, we all know we have access to smart devices such as maybe Alexa, smartwatch, our phone. Set reminders for them. It's not going to cost us anything. Set a reminder every 1 hour, every 2 hours, basically just to be engaged. Sometimes some of them are forgetful. So this is a little we can do to be part of their care. That's our first one. And the second preventive measure, I would say, we just have to find way around it. Teach them how to wipe from the back. No, from the front to the back. After using the bathroom. Yes. We're not gonna say it in a mean way. We just say, okay, mom or dad or grandpa, whichever way we approach them. I understand you've been taking care of yourself before I was born, but please, UTI, elderly ones are prone to UTI. So these are the preventive ways you can use to not to have it. So we can teach them, or you can, show this video to them. They can read and see what is going on. And if we have a caregiver, or if you're a caregiver to them, learn and write it somewhere. All the symptoms I discussed earlier, how to recognize them, so they can get once they exhibit 1 or 2 or 3 or more symptoms, then you can get them early help as soon as possible. And another preventive measure is educating them about voiding regularly and practice hygiene practices. So basically they should try to pee on maybe every 1 or 2 hours, or they now to do clean down there, something like that, so they don't develop or have UTI. Then talk to their providers, like for the urinary catheter, only when necessary, because this is a vital ground for bacteria to penetrate into their urinary system. And we should be engaged as well, or talk to them, our elderly ones, to manage their chronic conditions effectively, so they will not be prone or have a repeat UTI. Guys, if UTI is not treated, or if untreated, there are so many complications that can follow up, such as infection, sepsis, renal failure, reoccurring of that infection, and the last one, the increased risk of hospitalization and mortality. So if you're a nurse or caregiver or private caregiver, if you have other symptoms or preventive measure or other risk factors, please kindly comment below so we all can learn from each other. The goal of Nurse Mono official page in all social platforms is to educate ourselves, learn from each other. It's time for us to come together, help ourselves. That is very important, and that is one of the goals for Nurse Mono official. So there you have it. Understanding symptoms of UTI in elderly one is more than just a good nursing or care. It is a potential life savings. If learning about this topic inspire you to sharpen your clinical focus, then this is the community for you. Subscribe for more motivational and growth. Follow us for more on essential clinical knowledge and how you can help your family and friends. So, thank you for watching. Stay safe, stay smart. I'll see you in the next video.